Good afternoon, everyone. Thank you so much for joining us for this very first webinar series, The Power in the Public Narrative as an extension of the Celebration of Healing in partnership with Congo Square Theater and their production, How Blood Go. I'm Jamira Alexander, the President and Executive Director of Public Narrative, and I'm joined here with representatives from the City of Chicago, here to talk more about the Healthy Chicago Equity Zone. I'm joined here with Sona Fokum and Izzy Abrams, who are going to talk a little bit more about the Healthy Chicago Equity Zone. Sona and Izzy?
Hello, my name is Sona Fokum. I am a project coordinator for the Far South region of the Healthy Chicago Equity Zones at the Chicago Department of Public Health.
Hi, I'm Izzy Abrams. I am also a project coordinator with the Healthy Chicago Equity Zones at the City of Chicago, and I primarily work with the North Central region, so partnering with Swedish Hospital.
We are going to get started on our presentation. Today we'll be talking about the Healthy Chicago Equity Zones and what work we've done in the City of Chicago and for the different regions across Chicago for the past year or so. So the agenda for today will be, we'll start with a bit of a background on how these equity zones even came about. And then we'll talk about the citywide plan, Healthy Chicago 2025. And then we'll talk about how we developed Healthy Chicago Equity Zones. And then we'll discuss the progress that we've made up to this date. But first, we're going to have a little pop quiz just to see where everyone's at and how much people know about the work that we're doing and the background of this. So don't worry, there's no trick questions, and you are, I'm pretty sure the poll is anonymous, so you will never know if the answers are not right. But the first question is, what do you think the life expectancy gap between Black and white Chicagoans are? You can poll in. So do you think that it's 0? There's no difference in life expectancy, 4 years, 8.4 years, or 10 years? Is everyone seeing the poll? Are they able to answer?
Yes, we can see the poll, and we have all 3 questions up at the same time.
Okay. Well, I'm just going to go ahead and reveal the first answer. When you get the poll, I see some people have pulled in and they're right. The life expectancy gap is 10 years between Black and white Chicagoans. Okay, and the next question is, since 2012, how has life expectancy changed for Latinx Chicagoans? Has it increased 2.5 years, increased 0.9 years, stayed the same, or decreased 7.2 years? The answer for this one is actually decreased 7.2 years. And we will go into a graph of all of these answers. And the last question is, what played a major role in this life expectancy gap? Was it COVID-19, gun-related homicide, drug overdoses, chronic disease such as diabetes and heart disease, or all of the above? Yes, many people got this right as well. The answer is all of the above. So yeah, let's go into this. These are kind of the overarching questions of why this got started in the first place. So for a bit of background, this is a model of the life expectancy by race and ethnicity groups in 2020. So as you can see, there is a 10-year life expectancy gap between Black and white Chicagoans, and there has been a decrease in all racial and ethnic groups in life expectancy, and very notably a 7.2 decrease in Latinx groups. So overall, we've just seen a huge decline over these years, and the gaps widening even more. And that caused a shift and caused concerns, which leads into Healthy Chicago 2025. As well, we discussed the major contributors to this being COVID-19, chronic diseases, disease and injury. But it's also important to understand that mortality is a result of root causes, not just disease and injury, because this disease and injury is increased by risk behaviors. It's also increased by living condition, which is ultimately increased by institutional inequities and social inequities, which break down to racism, discrimination, immigration, ability, gender, and sexual orientation. So all of these causes are not a result in a vacuum. They are stemming from bigger societal and structural issues. And we want to understand these root causes to address these structures so that we can go in and trying the root to changing from the root versus changing from the result to produce real structural change, which leads us into Healthy Chicago 2025 and their goals and missions.
Okay. Hi. So every 5 years, Chicago comes out with a Healthy Chicago plan to address health inequities and health benchmarks that the city wants to reach. So it's on a 5-year schedule, as I said. So Healthy Chicago 2025 was released in 2020. And we really can't talk about the story of HCEZ without kind of going a little bit into Healthy Chicago 2025 and what came out of that. The graph that Sona showed a few slides ago with the life expectancy decline and gaps between racial groups in Chicago was part of this like bigger report that was done by the city. And I get this name wrong every time, and I'm like, I have to look this up before I say it out loud, but I believe it is called The State of Black Health in Chicago, and it was done by Sister Ya, who's a great, amazing epidemiologist here, and it was the first of its kind discussing health outcomes specifically for Black Chicagoans. And as you saw in the graph a few slides ago, the results were very stark. But something that we used some of our public facing materials around Healthy Chicago 2025. This is like the one that, we really like to use. And I keep pointing at my screen. I'm going to try not to do that. I'm going to tell you what I'm looking at. So as you can see, it's a tree. Thinking about, roots and root causes here. So, you can look at a tree and you see the fruits, and those are the more mortality pieces. So ending the HIV epidemic, improving mental health, less chronic disease, et cetera. But leading to that fruit is the branches. So what could contribute to less chronic disease? Okay, clean air, health and global services, or social services, might work to help end the HIV epidemic. And the trunk of the tree leads to these branches, and that is optimal health and well-being, because you can't have clean air or health and social services if you don't invest in the optimal health and well-being of people in Chicago. And then if you go to the very bottom of the tree, the roots, which is the most important part of the tree, is feeding the tree, it is giving it life. So that's like anti-racist and structural change, economic opportunity. So you really can't get the fruit without addressing the roots of the tree. And in the watering can, which is sort of a funny little graphic, is sort of kind of including that community piece in there. And I think that's where HCEZ plays into this, or the community power and freedom from oppression, because while the city can go in and make suggestions and ask community members to change, really what we want is for community members to have a voice and be able to express the things that they want and they need. So that's our public facing graph for Healthy Chicago 2025. Oh, can you go to the next slide? Thank you. I was doing it on my own computer. And so the Healthy Chicago 2025 came up with 4 basic principles that was improve systems of care for populations most affected by inequities, further the health and vibrancy of local neighborhoods, strengthen community capacity and youth leadership, transform policies and processes to foster anti-racist, multicultural systems. So we also picked some health indicators here. So we have housing, food access, environment, public safety, neighborhood planning and development, health and human services, and public health systems, which we believe kind of help elevate those assessment themes. So this is just a nice graphic that kind of talks over our research principles and the indicators that we chose. Oh, I keep doing that. And so part of the way we kind of looked at Healthy Chicago Equity Zones out of Healthy Chicago 2025 was thinking about this through an inside-outside approach. And as you can see, this is a circle. So everything keeps leading back to the beginning. So first we analyze data, assets, and opportunities. We support community co-owned solutions, make system level and policy changes, evaluate impact, and then go back and do that all again. You can go to the next slide. And then another thing that we, as part of the Healthy Chicago Equity Zones that we think about and work through is that equity is both a process and an outcome. So as an outcome, equity results in fair and just access to opportunity and resources that provide everyone the ability to thrive. Acknowledging the present historical inequality that persists in our society, equity is a future state that we strive to create where identity and social status no longer predestine life outcomes. And so that's the outcome that we're looking for. And then as a process, equity requires a new way of doing business for us. One that prioritizes access and opportunities for groups who have the greatest need, methodically evaluates benefits and burdens produced by seemingly neutral systems and practices, and engages those most impacted by the problems we seek to address as experts in their own experiences, strategists in co-creating solutions, and evaluators of success. So just more of the Healthy Chicago 2025 guiding principles that we brought into Healthy Chicago Equity Zones as well. So anti-racism, and you can read this through, asset-based, equity-focused, trauma-informed, capital building, and community-led. And these are things that are really important as we move through this process and things that we're always working on improving.
So from Healthy Chicago, From Healthy Chicago 2025, we then are developing our equity zones. So we actually developed the process of, in the sectioning of the equity zones from the Rhode Island State Department of Health. They actually created a health equity initiative. So on the basis that our current healthcare system is not oriented around diminishing health inequities through prevention-based approach, it's more through many people go to the hospital or go to the doctors or seek healthcare when they've already are experiencing health issues rather than promoting prevention. And public health expenditures have fallen by 9% since 2008, and it is projected that public health spending will fall down to only 2.4% of total health spending by 2023 this year. So public health prevention approaches often reflect federal initiatives, available funding sources, or existing programmatic expertise instead of responding to community identified needs. So this health equity initiative resulted in a theory of change that if we invest in defined geographic areas to develop sustained infrastructure and align a set of diverse resources to support community identified needs, then we will have a positive impact on the socioeconomic and environmental conditions that drive disparity. So these Healthy Chicago Equity Zones were structured as place-based. So this meaning that it is defined based on the community's specific needs. It's health equity centered, community led. So the community is leading this work and informing this work, and it's based on the social determinants of health. So for implementation, the Healthy Chicago Equity Zones, based on the Rhode Island Health Equity Zone theory of change, will lead to hyperlocal strategies to confront the social and environmental factors that contribute to health and racial equity, with the ultimate goal of closing Chicago's life expectancy gap, as you saw from the graph with the very wide life expectancy. So once again, we're doing this on a place-based, community-led, and equity-centered implementation. So here is actually how we define our health equity zones. We have 6 equity zones that cover the entire geography of Chicago. We split the 77 neighborhoods into the North Central area, which the regional lead, the community-based organization that represents or is the point of contact for the North Central region is Swedish Covenant Hospital. We also have the Northwest Center, which covers the Northwest. On the west side, we have Westside United on behalf of Rush Medical Hospital, the Southwest Organizing Project, Greater Auburn Gresham Development Corporation, and Phalanx Family Services for the Far South. So these 6 regions and these 6 regional leads are the point person or the basis to the work that we're doing in Healthy Chicago Equity Zones. And they are coordinating the work done in their specific region, and we all come together to make the best choices and health decisions for the entire city of Chicago. So the structure of how the health equity zone is modeled, and this graph, it looks like it's a ladder, but it's more so a circle. But the best way to explain it is the Department of Public Health defined these 6 equity zones, and we provide funding and support for each of the zones. And then we have a regional lead, which was each of those 6 organizations that we named. So there is one regional lead per equity zone, and they provide funding and support and action planning for up to 16 community leads. So these community leads represent different community areas within that region. And they are the ones out doing groundwork, and the regional lead provides funding and support for them. And the community leads provide funding and support for community networks and activations, as well as other community needs such as community groups, health providers, schools, faith-based organizations, and businesses. And together, this structure provides a network of networks to coordinate a hyperlocal neighborhood network where it's community-led, and there is support and structure from all ends of this per se ladder. And the strategy behind the Healthy Chicago Equity Zones is on building on the successful racial equity response team and Protect Chicago Plus vaccine equity pilot, which began in the leadership of the COVID-19 vaccination campaigns. And now we are in the phase of focusing on building hyperlocal community assessments and action planning to prioritize health disparities areas related to Healthy Chicago 2025. So why HCEZs? HCEZs are critical public health infrastructure that help expand and maintain neighborhood networks, conduct neighborhood assessments, establish and implement health and racial equity plans, disseminate various public health materials, and coordinate research, education, and engagement strategies. HCEZ also is very crucial in building systems to collect and analyze community health data, developing community-based participatory research agenda, assisting in building support for citywide efforts and initiatives, and identifying and proposing policy and system changes that address barriers to community health and well-being. So as for the HCEZ timeline from July 2021 to May 2022, we were in phase 1, which was vaccine equity. And in this, we was funded by Immunizations Grant, which created neighborhood engagement and communication plans with all of the health equity zones disseminating vaccines across their region and being the trusted messengers in their community to conduct direct vaccine outreach. Right now, we are in phase 2, which is capacity building. And in this phase, we are doing a lot of training and technical assistance, building and expanding cross-sector community tables, collecting and analyzing local data to address our community health priorities in our community health assessments. And right now, we are in the action planning phase to plan for the initiatives that we would like to produce based on the priority areas that we have found during our community health assessments, as well as doing more research and policy agendas. And the next phase will be local activations. So leading grassroots initiatives to improve health awareness, linking community members with resources, and continuing to address the root causes of health, including structural racism. To go more into these community health assessments that we actually just completed, they were informed by the National Association of county and city health officials mobilizing for action through planning and partnerships. This is a very long name. So it's informed by NACCHO's MAP process and supported by a tool that we created at CDPH. The regional lead organizations supported the community lead organizations in building hyper-local level networks of networks, with working with the coalition to do surveys, focus groups, interviews, groundwork interventions to really go into the community and find what the community feels that is lacking in their areas, what is the barrier to their specific health, learning from the community about what the community may need. And we did this with primary data and secondary data, which was the background using Chicago Health Atlas, Chicago Data Portal. But it was important that we found what exactly the community was feeling and thinking and experiencing, because some of these secondary data do not tell the whole picture, especially in certain areas where it doesn't even, the research may not even reach, for example, the far south side. So we use this as a consensus to identify priority areas, and then these priority areas that we identified inform the action planning that we are in the process of.
So here are some of the things that we have accomplished to date. We can go to the next slide here. So just some important benchmarks that we reached between December 2021 and July 2022, which Sona talked about with the vaccine work. HCEZ's led over 1,900 hyperlocal COVID-19 vaccination outreach activities, reaching over 161,682 residents and supporting over 21,000 vaccinations. And that is incredible work. 4 HCEZ regions are still working with IDPH, the Illinois Public Health Institute, to increase access to diabetes prevention programs. And HCEZ regional community leads promoted fentanyl test kit community builds to help prevent opioid overdoses in all 6 regions. So this is just further exemplifying that HCEZs are equity-centered and people-powered to advocate for resilient communities. And a lot of these things, like diabetes is something that the region specifically asked for. So we are trying to provide those resources. So for the community health assessment that Sona briefly touched on, that we wrapped up at the end of 2022, just some of the data points that came up here. So there were over 7,000 surveys that were distributed by regional and community leads. They performed over 84 focus groups, quick polling and interviews, and they completed 6 regional community health assessments. And you can see some of the numbers here. So that's 39 community profiles, 72 communities are being assessed in these community health assessments. And you can go to the next one. And these are just some of the community events that our regional and community leads put on. As you can see, people are showing up, whether, even with the pandemic, they're outside or they're inside. But yeah, these are just some examples of events that have been held and some engagement opportunities as well. Swedish Hospital did a massive book donation drive. And so on the bottom left, you can see they actually drove the books to the sites that they were donating to and dropped them off. And that one in the middle as well. There's also pictures of vaccine events. So a lot of really great work is being done in our regional and community leads. And that is all. Thank you.
Thank you, Izzy. Thank you, Sona. Before we open it up for any questions and answers from Sona and Izzy, we're actually going to have a moderated panel discussion with Josh McGee, who will be moderating and alongside other members of the city who are health equity zone project coordinators for this. So I'll hand it over to Josh, and Josh will lead us in the discussion. Thank you.
Hey, I'm Josh McGee. I'm a reporter covering the intersection of criminal justice and mental health for Mindside News, a national outlet focused solely on mental health. Thanks for having me. My first question is just kind of about the data that you guys collected. You guys formed a lot of focus groups. What were you guys focused on? What were you discussing?
So we actually created a tool with that was mainly focused on root causes. So we were focused on, it was depending on the region, they kind of took it their own way, but for the most part, they were focused on how they were engaged with their health, seeing the doctors, or what do they use for health on a daily basis. Depending on, we based it on the Chicago Health Atlas. So the Chicago Health Atlas has a lot of data that you can use per neighborhood. So we looked at a list of indicators of health, I think it was about 60 indicators, ranging from drug use to housing, median income. And we use that as a basis for the questions that we tailored toward the community. So depending on what areas from the Health Atlas were under the Chicago median versus over the Chicago median, those were a basis of what might be a health disparity within that area. And then from there, we developed tailored questions for the community.
And then what were some of the things that the community felt needed to be addressed?
So we had them, Nicole, you can go ahead. I've been talking for a while.
Sure. So every part of the goal of this was to have different priorities across the different 77 community areas. Some of probably the three most common themes we did see across the regions and community areas was public safety, which of course is broad and can include different things. Mental health, as I know you mentioned, is part of your background. And alongside mental health, substance abuse as well was a particularly focus in the West region. And housing and healthcare access were some of kind of our overarching themes that really came out of these conversations.
And this is focused on closing the gap in life expectancy. So one of the things that seemed to be leading to this gap was the gun-related homicide. What kind of things can be done to address this from the health standpoint?
Sure. And I know the public safety is a focus area of, I think, the Near South region, and they've identified a couple of specific interventions. So John, I don't know if you want to chat a little bit about what they're thinking about there.
Yeah. So with the Near South region, public safety is definitely an area that they want to discuss further. And with that, with the whole HCEZ plan, Sona and Izzy did a great job of explaining that. But the next steps is action planning. So the conversations of addressing certain topics are occurring now. And our community-based organizations, our regional leads and community leads are the ones igniting those conversations, facilitating those conversations. And so that, to answer your question, those conversations are happening now. And that's from a community-based perspective. So I don't have like a logistical standpoint for you, but those conversations are occurring within our regions.
Gotcha.
And something I can add to your question for gun-related homicide, something that we've been talking about in the Far South, a lot of it, addressing the root causes, which is mental health. A lot of the violence is a result and also a cause of mental health issues, especially in the Black community in the Far South, as living in violence results to a lot of mental health issues that people do not associate. Mental health looks different in different communities. So something that they in the Far South is focusing on to address gun-related homicide and violence is really going into mental health of their community members and trying to address how the violence in their community has impacted their mental health, and then how that may result in the violence being a cycle. So that is one aspect of it. We're still, obviously, as John was saying, there's a lot of conversations to be had on what specific interventions that we can do to make tangible results and really lower this the result of gun-related homicide. But I know mental health is something huge that the Far South region is focusing on.
And how do the plans kind of envision making it easier to talk about mental health and to provide like those services for mental health that are so needed?
Some of these are coming up in the action planning phase. And so it really depends on what the regional leads and their community leads want to implement in those spaces. I think Jon was about to say something.
Yeah, so when we meet with our regional leads, we have our exterior presenters come in, and we have had the new 211 Metro Chicago involved in our regional lead weekly meetings and expressing desire for services to be applicable in our region. So those are conversations that are happening and partnership and future collaboration as well to provide practical services to our community members.
And the equity zones are based off Rhode Island, which has a very different kind of demographic than Chicago. So what did you have to change to make it different and tailored to Chicago's needs?
And I know Jenny was kind of more around for the origin of the Healthy Chicago Equity Zones. I didn't know if you wanted to tap in on that one, or Vita. I don't know if Vita had to step away for a second. Let's see. Hey, Jenny. Sorry to tap you in right there.
Hi. Could you repeat the question for me, please?
Yes. So the process is the equity zones are based off of Rhode Island, which has a different demographic kind of structure than Chicago. So I was just wondering what you guys had to tweak, do different to kind of tailor this to our city.
Oh, thank you for the question. Absolutely very different. Rhode Island model is a state-based model. We also allowed it to have different funding structures coming. So we took lessons developed. Hearing that my audio's going in and out, so let me try the headset. 1 second, please.
Okay.
How is this? Is this a little bit better?
Yeah.
Okay. We took lessons learned from the model, and one of the things that we did when we created the outline of a model for Chicago was to ensure that it was going to be community co-led. We knew that we wanted it to cover the entire geographic area of the city. And so as we identified our zones, making sure that we covered all 6 areas, the whole area. And then as we brought in our partners and continue to look at the other models besides Rhode Island, there's also Ohio, some other areas that have done it. We brought the communities in to help us develop what it looked like, including an equitable funding model for when we had the funds to distribute and determining together what data factors made the most sense to the community to use and trying to figure out how we fund what. But it's all about the people in the communities making the decisions or helping us make decisions.
Gotcha. So I got a question here. I'm going to lead into it. Can you guys just explain, since this is working about life expectancy and closing that gap, can you just explain how racism kind of plays into the gap in life expectancy?
I will take it again, if you don't mind. And then team, feel free to jump in. And apologies for joining late. I didn't actually introduce myself. I'm Jenny Turner. I use she, her pronouns. I'm the Director of Health Equity and Strategic Partnerships here at the Department of Public Health. I support my team and of course the community within the equity zones. I encourage anybody who's not familiar with how racism really impacts public health and your own health is to do a YouTube search for the tale of 2 zip codes. It really lays it out how everything impacts health, things that people don't realize, your ability to find groceries, to have walkable neighborhoods, to have good jobs and good education. All of that really builds up and impacts your overall health and well-being. We also highlight this in our community health assessment and improvement plan, Healthy Chicago 2025, that I know our team spoke to earlier. And it's amazing how a lot of our community partners who have been with us for a few years now say, you know, I really didn't see our organization as public health because we focus on housing. Housing is public health. You have poor housing, that also impacts public health. There's also a racial equity element to the housing within our city as well.
And that YouTube link was A Tale of Two Zip Codes?
2 zip codes, yes. Okay. Somebody Google that and make sure I'm not lying to Josh here, but I'm pretty sure that's the one that I typically give everybody. It's from California, I believe, but it applies across the board.
And we got a question from the attendees. Can you speak about how the zones work towards racial equity?
Yeah, I think, I was going to say, building off what Jenny was saying about really the place-based nature of this work, I think that's one of the strengths of the zone. So not only do we have the 6 regions, so I work, I also realized we didn't introduce ourselves. My name is Nicole Marcus. I work with the West region. And so I support our West region lead, West Side United. And so when we're able to kind of convene the community leads for each of the neighborhoods on the West Side, whether that's North Lawndale, Humboldt Park, South Lawndale, Little Village, West Town, and really kind of talk about specifically the issues locally. So I think that's one of the ways we're able to surface things and really empower the communities in specific areas to lead on that. So I think one way in terms of racial equity is kind of baked into the way we approach this work is having a community lead for each specific community area. So there's a group, you know, leading the work in North Lawndale who can specifically raise up the issues and connect with the community and partners there. So I think that's kind of part of the whole, how the zone model is structured, as well as, you know, when we were doing the focus groups, I think, I don't know, I'll pass this to Jon too. One thing I think that's been really cool is hearing about the specific groups that we were able to engage. And I know the Near South had a special focus group, if you want to talk about that.
Yeah, so Jon Jones, project coordinator for the Near South region. Our regional lead is Greater Auburn Gresham Development Corporation. And one of our community leads, Bright Star Community Outreach, held an all men's focus group in the Bronzeville area, I believe. And the conversation, I wasn't a part of this focus group, but the conversation addressed a lot of topics regarding men's health, men's behavioral health, anxiety, living in environments that they grew up in, and just brought up the opportunity to address how they as individuals have experienced inequity or health disparities by their neighborhoods, by their zip codes. So that was one like practical step toward addressing that and retrieving the data for these community health assessments. So thank you, Nicole, for sharing that.
So one of your tangible, can you just talk more about some of your kind of examples of success that you guys have had in these conversations? I think that's a good example. Can we go to maybe, do we have anyone from the northern region?
Yeah, I'm North Central. I did see a question in the chat that I just wanted to lift up about explaining what hyperlocal is. I think part of what we want to do with this work is engage all organizations in public health work. And if we're not explaining terms and we're, talking in jargon, that's not helpful. So I really appreciate that person asking the question, what is hyperlocal? And please explain these terms. Very fair. And so hyperlocal, what we mean by that is just, local would be the Chicago area. Hyperlocal, we're literally talking about uptown. That's my region. So I'm just thinking about them. So issues local to uptown rather than issues local to the north side of Chicago or the north central Chicago. So just really focusing on local and in the neighborhood, in the community. And so your question was about successes in conversations. Is that what it was? Sorry, I got excited.
So just some examples of successes that you guys have been having in some of the neighborhoods.
Yeah. So in the North Central region, something that is very prescient to them is in the Westridge community in particular. There have been a lot of new arrivals being housed in that region. And so something that has come out of that is a kind of a refugee coalition. So it's sort of, and it's with Rogers Park and Westridge and those, so that's like a cross community collaboration. And so it's kind of bringing these two community leads together to lift up issues of refugee health and refugee needs in those communities. So that has been something that I think has been tremendously successful in that region. And I think that would be one thing. And then I think, Nicole, you were going to talk about vaccine work in Belmont-Cragen.
Sure. Yeah. So as I mentioned, I work in the West region, but I wanted to kind of highlight some success in the Northwest region that we saw. As we mentioned in the beginning of the presentation, while this work has really expanded to be all of health and racial equity work, part of pivoting for COVID was focusing on vaccine work and really getting out, COVID testing and all sorts of COVID response. And one of the areas we saw one of the greatest increases in vaccine uptake was Belmont-Cragen. And they were really successful in kind of deploying a community health worker force. So where folks would go to the door and have personal one-on-one conversations, in people's native language to kind of talk to them about the vaccine. And they really went from having one of the lowest vaccine rates in the city to one of the highest over the course of, their year plus work in this area. So I think that's where you really get to see the impact of one-on-one conversations going to people's doors, and the fact that it was managed by an organization based in their community. So they're really able to recruit the right people, walk the right blocks, kind of be at the right community events in a way that can be hard to orchestrate purely from a city level. And so that really was the strength of the partnership with these local organizations. And so, like I said, that's the vaccine work. And that's really what we're continuing to bring into that approach into our health and racial equity work.
And Izzy, we were talking about the kind of influx of refugees. How do you involve something like that where you're not really expecting this to happen? How do you involve that in kind of your process going forward?
That's a really good question. And this was something that was completely taken on by Swedish and their community leads. So I was not involved in this, and I'm honestly not sure if I can speak to city policy on this really, but yeah, this initiative in particular was completely community led.
So if you're in a community like Westridge, and you want to get involved in kind of improving these things and seeing this life expectancy gap close, how do you get involved? How do you reach out to the smaller leads that are on the ground? How does that work?
Yeah, so that's a great question. We love when people try to get plugged in with our Healthy Chicago Equity Zones. So one thing we would always advise is to reach out to your regional lead. If you're, for example, if you're looking for the Westridge neighborhood and you are interested, you would reach out to Swedish Covenant Hospital and ask for their HCEZ team. And I'm sure they would love to get back with you. But also, we also have an email at healthychicago@chicago.org. I can put that in the chat, or I can share the information with you. But that's also a good resource to reach out to. But yeah, so reach out to the regional lead in your region, and we have that email available to for any questions, anything of that nature.
To clarify, Healthy Chicago at cityofchicago.org.
At cityofchicago.org, yes. Thank you, Jen.
And how did you guys involve the youth in this process?
The youth has been involved, honestly, at the community level and at the regional level. We recognized that the community already had these connections. So Sona can speak a little bit to like Far South and Phalanx and their great connection with the schools. But that is the main area that how the youth are involved.
Yes, you were asking how can the youth be involved in this process?
Yeah, how were they involved
Oh.
will they be doing in the future to be involved in this process?
Yeah, specifically in the far South, that is a really huge pillar for them. They think, youth are the next generation in health, and, so they go actually to this, they're connected with, I don't even have a number, but they're connected with all the schools, mostly the schools in the far South, especially they also host most of their events in one of those Chicago public schools, so that the youth, their families, the smaller children, all of them are exposed to all of the things that HCEZ is doing, all of the vendors they may have, all of the health opportunities that they have. I know in some of the community leads themselves, there's a community lead called Graduates Over Guns, and that one works specifically with teenagers and Chicago public schools to, produce graduates over, gun violence. So that's something to, that's one of the initiatives that you can attribute to reducing the gun-related homicide that you asked for earlier. But yeah, we, especially in the far South, and we encourage other regions to do so, host events at Chicago public schools and really try to get the youth involved so that as they're growing up, this is something that they have instilled in them to keep in mind in their future of preventative health versus response to health, and just having these conversations early on. As well, we also had many focus groups with the youth. We had some focus groups with elderly and just school children and teenage children. So that is how in the far South, a lot of the responses were actually from school children and teenage children, informed a lot of the results.
Okay, so what's the anticipated lifespan of the HCEZ model?
Sure. Yeah, I think always looking forward to the future. As I mentioned, we've kind of already been through a couple of phases of this work. So our current funding for HCEZ goes through mid-2024. But as was our intention from when we kind of kicked it off, in 2021, our goal is to the original RFP went through 2025 to work with these regional leads that have been identified. As with a lot of things, we're actively pursuing additional funding sources. We really believe in this model, and so we hope to see it continue for a long time. But we have it at least currently through 2024 and hope to see it go well beyond.
And then what's the future of the HCEZ if under new mayor?
Hi, I'll introduce myself. I'm Vita Noel, and I'm the project manager for HCEZ. And so with that, we will not know exactly what the new administration would bring. We can't speak on what they will do. But what we can talk about is the work that we've been doing in the network. Our partnership development, our planning, our capacity building work that we've been doing with community-based organizations. We believe that there's a continued benefit to our communities. Also, we believe that the long-term supported partnerships are critical for the public health infrastructure. We believe strongly in this model. Nicole just mentioned that. We believe that this model will greatly benefit Chicago. We'll be sharing the success of this model and highlighting all of our milestones in future conversations with the new administration. And we hope that they will take all of that into consideration as they make their future decisions about the future of the HCEZ network.
Okay. One of your guiding principles is capital building. What does that look like in practice?
I'll try that one. One of the practices is the equitable funding model. This kind of relates to the question that came through the Q&A. How does the structure of the program ensure community partners have autonomy in their planning and priority setting? So for where we do have the ability to let the community decide how funds are spent, and I'm sure many people understand that funding the people who own the funding will set parameters around it. We really wanted to be able to give power to the community as much as possible on how they wanted to see this work go forward. So again, just bringing them to the table, having those discussions. We didn't tell them what their priorities had to be. We explained this is the bucket of money that we have to do with what we want to do, help us develop the statement of work. So capital building, at least from where we are currently in the phase of the equity zones, which is honestly relatively new. I was just in a meeting with Rhode Island yesterday, and they talked about they are at their 8-year mark, and they really expect to see true change starting to come through around year 10, because the buildup has been, it takes a while to make transformational change as opposed to transactional change. So to me, I really want to see, and I am actually advocating at both the local and the national level for more flexible funding. I mean, it's great to say, hey, here's $500,000 to do eye exams throughout the city. And we need eye exams with the kids. No one's saying that we don't, but is that the most important thing to that community at the time? And part of that capital building is giving flexible resources to the community to actually put the plans that they have developed into action. So we got to change the system. We got to shake the trees. And we hope that those of you who are on the call are also advocating with whoever you can about this as well. Let's restrict the funding into these communities.
But I think you got a little bit into this, but one of the questions was,
sorry.
How does the structure of this program ensure that community partners have autonomy in their planning and priority setting?
Yeah, so again, making sure that they are at the design table, right? You got to do it from the beginning, as much as possible. So bringing everybody around the table to have those discussions around the design. So every step along the way, we try to be intentional about it. And, honestly, I've actually had, people within the city say to me, like, Jenny, why are you taking 4 weeks to determine how much money goes where? Shouldn't you just tell them what neighborhoods get what money? And you don't get buy-in that way. I'm like, yes, it takes longer, but guess what? In the end, everybody is in agreement. Even if their neighborhood did not get as much as they wanted to, they all agree on the factors that we came together to decide on how we split the pot. And it's never enough. It's never enough. So please continue to advocate with us, please.
And what's the next couple months looking like to the end of the year? What can we expect from you guys and your teams?
Well, we have a few balls in the air right now. So we kind of touched a little bit on action planning, and that's the next scope of work that all of the regional leads are going to be participating in. And I can't totally speak to how that will look for every region because it's going to be different. We're also partnering with UIC School of Public Health on evaluating the outcomes of the grant and HCEZ. So those are a couple of the things that we have just kind of going on right now. And I don't know if anyone else has anything to add there.
Yeah, I think, as we talk about, we've kind of spent these last couple of years and this time really investing in the regional leads and community leads and planning and helping them build and really watching them grow their coalitions and their partnerships. And so I think this is where it gets exciting to be able to leverage those partnerships and work on specific interventions around these priority areas that were really determined by the community. And so, as I mentioned, the West Side is focusing on mental health. And so I think there's an opportunity if, folks are interested in plugging in, as we mentioned, reaching out to the regional leads and really cross-collaborating with not only kind of the partnership network that they've established, but continuing the partnership with CDPH, with other, city departments and with other philanthropy and other organizations. Now that we have these, place-based networks, I think it will be really leveraging those into specific things, whether that's a mental health education campaign, as you kind of touched on earlier, of how do we get the word out about that And I would say, as we've mentioned, we're still planning these specific interventions. So we maybe don't have an exact answer for you right now. But I think you'll see some really exciting things coming out of each of the regions in a couple months and then through the rest of the year.
And have you spoken about natural health and holistic approaches?
I think, and the person who typed the question, please correct me if I don't answer this properly. Access to care is one of our priority areas in Healthy Chicago 2025, and it's a priority area in some of the neighborhood assessments that have come up. We don't limit access to care, what that means to the community. So if that community feels make sure I get the words right, the natural health and holistic approaches is what's important to them, then we want to help them find the resources to do that.
And was this event promoted broadly among the HCEZ project partners, regional community leads?
We did share it at our cross-regional meeting this Tuesday. So it was shared, and the idea, as Sona kind of talked about with our structure, is that the regional leads will then take it to the community leads. So as far as we put it out there, hopefully they spread it.
Who are some of the project partners involved?
Yeah, well, our biggest partners, definitely the 6 regional leads. I think we listed them earlier, and we dropped this in the chat, but just wanted to lift it up here as well. If you want to see those regional leads, as well as more about the program, chicago.gov/HCEZ. That's our quick link for really those project partners. Yeah, I don't know, Jenny or Vita, did you want to talk about kind of any of the other partners?
Yeah, we actually partner with a lot of cross-sector groups. We have the one that is CDPH co-led, the Partnership for Healthy Chicago. Our project management partner right now for this phase of work is the Public Health Institute of Metropolitan Chicago. And we are doing a lot of investigation into honestly partnering more internally with other projects within CDPH and programs across the city. And, the equity zones is really a network of networks, right? I mean, all of our regional leads have huge networks, and they bring to us, ideas about, potentially partnering and collaborating within this next phase.
And does HCEZ overlap with any other city initiatives like We Will Chicago or Protect Chicago?
Maybe not overlap as much as it is like connect. So we are tied to, the Protect Chicago was the initial COVID response and recovery, of which the HCEZ honestly was born out of. The We Will and Together We Heal, which is the racial equity work. We are definitely connected in those spaces as well. We just had the mayor's office, Candace Moore from the mayor's office of Equity and Racial Justice come and talk with our regional leads about opportunities for some more direct connections between some of the projects that they are producing with the Folded Map Project and some work that we could see promoting through the equity zones as well.
All right, well, not seeing any more questions in the chat. Jamira?
All right, thank you all so much for just responding to those questions. Thank you all for dropping those questions in the chat. If you have any additional questions, I believe we had an email address that we could send those questions to healthychicago@cityofchicago.org. I am Jamira Alexander, the President and Executive Director of Public Narrative. This has been our very first Power in the Public Narrative series webinar to introduce the celebration of healing in partnership with Congo Square Theater. If you have not gotten a chance to see How Blood Go, please do so. It is indeed a stage production about health equity and, quite frankly, the lack thereof in the Black community. Whereas we recognize the arts has a way of showing us the problems problems and oftentimes pointing to the solutions, we wanted to invite our health partners from across the city to join us in conversation to address how they themselves are being a part of the solution. So I want to thank you all for sharing this space with us during this time, just to share a bit more about the Healthy Chicago Equity Zones. I had an opportunity to moderate a panel during your C3 conference back in October, which is the Chicago Consortium for Community Engagement. And I was blown away by the project partners who are a part of the Equity Zone model. We'll be featuring 5 of those project partners over the next 5 weeks. So if you haven't shared broadly, please do so. Register for those other sessions. We'll learn quite a bit about maternal mortality, women's health, community building and relationship and network building among health resources across the area. And of course, just in continuing to support the Healthy Chicago Equity Zone model. We certainly hope that it remains even after the election. But all in all, just from what I'm learning about the work that is being done behind the scenes, these community partners have been deeply rooted in community. So however things go, we are indeed certain that this work shall continue. So thank you again for joining us. And please share next week's webinar with your networks. Thanks everyone for joining us. Thanks for hosting, Josh.
Thank you for having me.
Thank you.
Thank you.
Thank you.